but there are so many changes that are being asked of the talent acquisition process, right? And shifting hiring plans, targeting new critical need areas, accelerating the process, candidates having new concerns, stay in place measures, forcing us to go virtual. So many things are changing so rapidly. What our survey from healthcare is showing that many people are unsure right now about their hiring needs. 38% saying they're unsure about changes that they need to make to their own budgets. We're not seeing a significant, based on that polled audience, increase in budget or no change at all. So even though all of this activity is taking place, it doesn't seem like people are really provided any additional funds or an increase in resources to be able to do these things. So I think this really validates that talent acquisition teams are really feeling the squeeze of being innovative and making those changes. 96% of healthcare companies are likely or unsure about trying new sources, new vendors and services at this time. They're like, I know that there's a lot of people who are saying like, hey, well, we have all these amazing products, try them. It's also a very difficult time for people to find new things because of all the adaption. What are some...
I'm sorry, Julie, can I just add to that?
Sure.
You know, we're the opposite. I have to be honest. We're the opposite. We are looking at different ways of doing things differently, especially when it comes in the interviewing world. We're looking at different platforms and how we can partner with our ATS on how we can bring in people quicker. So I feel that in the middle of all of this, trying to onboard and recruit and interview and onboard, I said onboard already because I'm leading onboard right now. We are definitely looking at different ways of doing things. And that's what I mean when I said, you know, it's really forcing us to look at how we do things, because if I can incorporate a different piece to my recruitment process that's going to help me bring in pre-screen 25 nurses in 48 hours, I'm going to look at that, because that's what we need right now. I mean, our recruiters are interviewing and screening and sourcing and pipelining as many people as we can. But if I can find a company out there that can do some of that for me, we will do it. We will do it. So that's something that I think sets us apart. It's something that we're doing, and we're just trying to keep afloat with it. And of course, something that makes sense and that we can integrate quickly. But we are looking at different things right now, believe it or not.
Well, that's great to hear.
Yeah.
Because you seem to be having some success with making progress on accelerating your process and onboarding. It sounds like that has significantly accelerated. It sounds like you're focused on what areas and what do we need to find. And I'm glad to hear that, looking for new things. Because it can't be the same old every day in the environment that we're in.
No, you won't survive. Or keep up.
But what are some new developments that are helping you improve your talent supply in healthcare in general? I mean, there's a lot of things around us that, licensing requirements and legislation, there's a lot of things changing. Is there anything new developing that's helping you improve?
There's been some states actually, sort of outside the things we've been talking to, but we have found that individual states are trying to help their displaced workers as well. So we've actually found quite a few states very quickly standing up their own job seeker portals for those people in their state who've been displaced. And it's like, get a job now, and it's like they log in and it has all those companies and all those jobs that are hiring right at this moment. So I thought that was outside of the normal things we usually see and the technologies we're all using, I thought that was a really nice thing for the states to do to try and help out their own residents. So that one's been kind of interesting. So we've been watching those nationally like pop up and then trying to, get our jobs on them as quickly as we can to sort of reach out to those populations.
Well, there's the when it comes to the licenses for nursing, they have opened up that all states are not compact states. So we have the ability to hire RNs from Washington, D.C. who want to work here in New Jersey. So that has helped us a lot.
So many changes, so much shifting so rapidly due to how we screen talent, how we attract talent, the change in environment around us, making talent acquisition really tough. So keeping people inspired that are on your team to stay motivated and engaged and while working to adapt to all these changes, how are you helping to keep your own teams that work the talent acquisition front line motivated and inspired during these times?
It's hard. I think a lot of us have felt that like whiplash or being on a roller coaster. We're all human. I know our teams are all feeling anxiety about what's going on in the world. They have concerns about, their families and their loved ones, adjusting for some people, to working from home for the first time. So we're certainly acknowledging that it is sudden and the changes are frequent. But I think, for us, there is the fact that we are trying to put as many people back to work as quickly as possible, that I think helps, keep us inspired and keep us moving, that, we're really trying to help those people get to where they need to be. And then also, we're helping our members and our patients in our community. So I think that helps drive some of our team and, helps us manage that sort of stress that we are doing good things on a daily basis.
Yeah, I mean, I have to say the same. Empathy is the word that we continuously use, and stay focused. And what we're doing here is we are just helping those folks that are at the sites. We're corporate, so we're not at the hospitals, and we are here to help them staff their departments, their units. So it's when you're a recruiter, I feel that that's just part of your DNA, is that you just want to help people, and that's what we're doing. That's how we stay. Yes, it's rough. It's 7 a.m. sometimes to 7 p.m. or later, but that's what keeps us going, is knowing that we are helping our team members, our peers. It has brought us together, which has been really, really nice to see. We're all pitching in where we can.
Yeah, I would just echo that. And, I'm not even working in a care provider, but I feel inspired, and I try to inspire my team in that what we do every day is actually directly contributing to fighting this fight that it is affecting everyone. And there aren't, most people aren't in the position to directly contribute. And to all those who are actually directly employing clinicians or healthcare workers, hats off to you, because you're having an even more direct impact on it. And you're finding people who are going to directly fight this fight. So, we can have a direct impact on the solution. And to me, that's inspiring. And that's what I try to focus my team on.
Yeah, I completely agree with that. I think I'm working longer and harder than I ever have in my career, feeling the same thing, right? I am not a healthcare provider. I can't work the front lines, but the work that we're all doing in talent acquisition is keeping people in work and helping get the care providers where they're needed most. So I think that's tremendously inspiring for everyone that's on the call that works in talent acquisition. Is that's our purpose right now. That's what we can do to make a difference to our entire nation right now.